Hello, everyone. In this video, we will be talking about leukemia, a type of cancer that affects blood cells and bone marrow. Leukemia is a serious disease that affects people of all ages, but it's most common in children and older adults. In this video, we'll cover the causes, symptoms, treatment, and prevention methods of leukemia. So, let's get started. Leukemia is a cancer of the blood cells and bone marrow, which are the spongy tissue inside the bones where blood cells are produced. In leukemia, abnormal blood cells are produced in the bone marrow and then enter the bloodstream. These abnormal cells don't function properly, and they crowd out healthy blood cells, which can lead to serious health problems. There are several types of leukemia, but the four main types are acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, chronic myeloid leukemia, CML. The type of leukemia depends on the type of blood cell affected and how quickly the disease progresses. The exact cause of leukemia is unknown, but several factors can increase the risk of developing the disease. Some of these risk factors include exposure to radiation, exposure to certain chemicals, such as benzene, previous cancer treatment with chemotherapy or radiation therapy, genetic predisposition. The symptoms of leukemia can vary depending on the type and stage of the disease. Some common symptoms of leukemia include fatigue, fever, frequent infections, easy bleeding or bruising, pain in the bones or joint, swollen lymph nodes. The treatment of leukemia depends on the type and stage of the disease. The primary treatments for leukemia include chemotherapy, radiation therapy, and bone marrow transplantation. Chemotherapy uses drugs to kill cancer cells, while radiation therapy uses high-energy radiation to destroy cancer cells. Bone marrow transplantation involves replacing diseased bone marrow with healthy bone marrow. This procedure can be done using a patient's own bone marrow, autologous transplantation, or bone marrow from a donor, allogeneic transplantation. Preventing leukemia is challenging since the exact cause of the disease is unknown. However, some steps can reduce the risk of developing leukemia. These include avoiding exposure to harmful chemicals, such as benzene, reducing exposure to radiation, following a healthy lifestyle, including eating a balanced diet, exercising regularly, and not smoking, getting vaccinated against viruses that can cause leukemia, such as hepatitis B and human T-cell lymphotropic virus type 1, HTLV1. That's all for today's video on understanding leukemia. We hope you found this video informative and helpful.